up with pregnancy loss or abortions. So, Ushna Tishna Aushadis for these people, is it advisable?
Kashyapa has already told in his in classics that Ushna Tikshna Dravyas should be avoided for the pregnancy, whatever may be the condition. But depend upon the dosha and the prakriti of the pregnant lady, we can select some of the medicines which are suitable for the present condition. And there are so many Ushna Tikshna Dravyas are told for correction of metabolic disorders and or infectious conditions. Most of the times, the repeated pregnancy loss is because of different infections like torch infection or any genetic causes are there, and abnormal food habit, lifestyle. So depend upon the pathology, we can select Ushna Tikshna Dravyas along with Grita mixed with Grita or some Shita Vira Dravyas we can give. There is no problem if you use in mild doses.
Ma'am, one more question to you, ma'am. Anita, ma'am. One more question. Ma'am, there is explanation of Muda Garbha in Ayurveda. How do you correlate it with modern practices today?
In the clinical practice, Mudagarbha, we can correlate the obstructed labor or difficulty in labor. What I have seen in my clinical practice, if there is delay in first stage and second stage, that also we can consider as Mudagarbha. Because in the context of Mudagarbha, the main pathology is related with the Vata dosha. Vata dosha dushti can take place in any aspect of the process of labor, maybe in first stage or second stage. And if there is delay in first stage, that is due to difficulty in dilatation of the cervix or delay in the dilatation, definitely the cause is Apanavata only. And no need of abnormal presentation of the fetus to define it as Mudagarbha. Okay, even it is, we have to consider the Vata as the responsible factor for any type of difficulty in labor. Maybe the fetus is within vertex presentation. And in second stage, if there is delay in second stage, that may be shoulder dystocia may be there, or lack of bearing down efforts by the mother, we can consider that as also Mudagarbha. Because in our classics, what acharyas have told only the abnormal presentations. But we have to consider the basic pathology also in every angle of the process of labor.
Thank you, ma'am.
Just to add some more points of Moda Verba here. So basically it is related to the fetus behavior, how the fetus, right? So it's a presenting mark as well as lie of the fetus and attitude and denominator. So these are the various factors. So based on this, various gatis have been told in the context of Moda Garbha. So hope so you are knowing like there are basic co-presentations what acharyas have explained. So which are deviating from the normal euthanasia. So normal like so a fetus which is presenting with vertex presentation with flexed attitude with mainly as a normal occiput and sensiput, right? So those are the proportions which they undertake when it is vertex presentation. So which is confined to a normal. Anything deviating from this is we have in the context of gatis, right? Stila, Sankilaka, Parigha. So there are the various gatis right from, right? So Udara, right? So Nalagati. So many different abnormal and mal presentations have been told, which can be understood in the context of Mudagar. Right?
Ma'am, next question is about physiotherapy and its applications. So since ma'am is not there, I'll just ask it to you. Yesterday, Aarti ma'am had told about that belt which supports pregnancy. So the question is on that. Does it obstruct the engagement of head?
See, as per my knowledge, she has basically, it's her PhD work. She has designed a belt. So it's a maternal adaptation, anatomical adaptations during pregnancy, wherein there is a lumbar lordosis, right? So it is going to support the distending abdomen or the gravid uterus. So engagement is nowhere related. It's related to the abdomen. So the engagement of the fetal head has many things, right? So there are fetal diameters and the pelvic diameters. Right. So when there is engagement is concerned with many factors, it could be related to the power, passenger as well as the passage. So it sets in after 39 or 38 weeks. Right. So this belt is nowhere going to relate with the engagement of the head.
Thank you, ma'am. The question is open for all the resource persons. In condition of pregnant lady, if there is an adverse effect of the vaccination, then what protocol should be followed? It's general vaccination tool here.
So we have to follow the do's and don'ts, right? So we have to follow the vaccines which are indicated. So commonly we are giving in India is a TT. So TT so far is not having any adverse reactions. So as per the protocol, it is 18th week and the 24 weeks what we follow. And again, the booster is at every 18th week what we follow the booster.
Okay, thank you, ma'am. This question is to Sapna, ma'am. Is there any special nakshatra auspicious for the baby to be born? Auspicious nakshatra for fertilization and baby to be born.
Well, nakshatra is not said, but in ancient time, for the conception to take place, or for the coitus to take place, Hunnime, Amavasya, and such days should be avoided, is what it is said. Okay, because of the bad energy that is there in the cosmos, that should not enter inside. Fine. Suppose because this is an AC hall, so AC का अगर जो प्रभाव हो गया हमारे ऊपर भी होता है, और अगर बाहर अभी तेज बारिश आ गया, so definitely its coolness will be felt by us also, right? So that effect, whatever is seen in the cosmos on the Amavasya day, on the Hunnime day or Paurnami, that will have an impact on the fetus. By chance, if that day conception occurs, then definitely it is considered as inauspicious. Maybe only because of the vibrations in the cosmos. So that is definitely contraindicated.
Okay, thank you, ma'am. The next question is also for Sapna, ma'am. The question is, can a regular astrologist tell about the concept of abortions and conceptions and guide us regarding this?
Yes, 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 very much. Because in the basic of astrology, the astrologer will be definitely knowing about the Putra Bhava, and then the Guru that is, I really mentioned for the Putra as a Putra Karaka. So he can definitely guide. But the only thing is, the present Kali Yuga has become a corruption, where the corruption is not there. So that shouldn't happen. He sends to his own other purohits, and lot of money will be dragged by them for a simple puja that is done. वो नहीं होना चाहिए. Otherwise, a good astrologer can definitely guide the couple in a right way.
Thank you, ma'am. Ma'am, one more question, Sapna, ma'am. How 11th house is helpful in producing putra, although the aspect will be there that the planets of 11th house, but how important is the 11th house and its functions?
Somebody who knows astrology is asking this question. 11th house is a Labha Bhava. So definitely it is said that if more planets or whatever the planet is situated in the 11th house, the Labha Bhava, suppose for example Guru. If Guru Putra Karaka is situated in 11th house, definitely Putra Labha is there. And Guru is also Dhana Karaka. So for them, the Dhana also will be very good. So there's a plus point, definitely yes, इसलिए कभी कभी थोड़ा बेसिक्स ऑफ एस्ट्रोलॉजी मालूम होना भी जरूरी है. आई एम स्ट्रगलिंग टू मच इन माय लाइफ, लेकिन फिर भी मेरे पास ज्यादा पैसा नहीं आ रही है, बट the other person leading a thoda bindas life, he is getting more monies only because of probably more grahas in the labha bhava.
Thank you, ma'am. This question is open for all the resource persons. What are the remedies told in Ayurveda to maintain oral health for pregnancy?
Different kashayas are told for Kavala and Gandusha. Irimedadi Taila can be used as Kavala if there is gingivitis is there or infectious gums, and caries are there. And Dhupa Chikitsa is also told orally. Dhupa can taking a smoke in oral cavity. And there are few external preparations are told. Even for medicinal use also, they are told some glue preparations for inflammatory changes. They can be safely taken in pregnancy.
Thank you, ma'am. If anybody can add.
Just to add to this, we have observed that stomatitis and gingivitis, can be cured with the help of Agnihotra ash, what we are having. It can be mixed with honey and ghee, and it can be applied. So that has been observed.
Thank you, ma'am. If anybody else wants to add.
Even gum tone powder of Charak company and G32 tablets of Alarcin company also works wonders. Just an external application with a gentle massage to the gums works wonders.
Thank you, ma'am. Ma'am, the next question is, if there is reduced amniotic fluid, then what are the medicines or management to Ayurveda? And to all, ma'am.
Reduced amniotic fluid. So the management certainly depends on what gestational age the gestational age of the patient is in, right? So it is usually by the clinically where we can diagnose the reduced amniotic fluid. In turn, it needs to be validated through ultrasound. So ultrasound we have is amniotic fluid index, which needs to be evaluated so it is justified beyond the 28 weeks of gestation. So anything before that, we need to rule out the anomalies why the amniotic fluid index is less. So beyond 28 weeks, when there is a fetal viability, again, the management goes in terms of the gestational age, wherein again, before 34 weeks, we have to decide. So we have all Jeevani and Brahmanya group of drugs and the Kshiropakas. So which need to be given, which we can take it, and Brutapanas. Along with that, you need to periodically be vigilant. How much is the amniotic fluid? So anything below 6 centimeter of AFI, we need to take a decision. So based on, periodical evaluation and fetal well-being parameters need to be checked in, and accordingly we can decide.
Anybody can add?
To add some points to this, Falagrita orally can be given if she's in third trimester, but in first trimester and second trimester, severe oligohydramnios is difficult to manage. But if she's in third trimester, Falagrita orally 2 teaspoons twice in empty stomach can be given. And application of Falagrita at lower abdomen, like pichu, a cotton cloth dipped in Falagrita, and that should be spread below the lower abdomen at least for 2 hours per day. And if she is in 8.5 or 9 months, Falagrita Basti can be given, Dhanvantari Taila Basti. And here Vata should be normalized, especially Apana Vata. Dhanvantari Vati can be given orally. And some psychological treatment, because stress is also one of the major factors for this, along with some other pathological conditions. So along with other medicines and treatment, stress should be relieved by meditation or pranayama.
Thank you, ma'am. If anybody wants to add something.
Again, what we just saw, tranquility of mind is very much essential. So definitely along with yoga, meditation, mudras, Agnihotra will definitely add the benefit.
Thank you, ma'am. This question is to Dr. Sapna, ma'am. Does Ekanadi really affect the conception in couples? And if yes, then what are the remedies?
I'm sorry, I really don't know what is this Ekanadi.
Ekanadi of both male and female partners.
It is not Ekanadi. Oh, okay. The question was, yeah, ma'am, give me the clue. It is not in the conception, but it is with the matching of the horoscope between the male and the female, I think. That would have been a question like, Nadi actually, this, Antya Nadi, Madhya Nadi, and Adi Nadi comes, but that comes in a matching of the horoscope. Now, basically, those matchings that they do between the Vara and Vadhu is mainly because of this genetic defects. What a very beautiful scientific presentation that was given by one of the doctors. So all these was inculcated, behind in a much simpler way in our Indian culture. So that was the reason of it was not only Nadi, but the other that they really see, the 13 matches that they really see, even the Yoni they see. So all that, counts a lot, yes, for the genetic defects.
Thank you, ma'am.
Ekanadi is contraindicated. Ekanadi, Putranashaha, it is said as, and we have seen that, yes, Ekanadi, suppose both are Madhyanadi, husband and wife, so उनका बच्चों का कुछ ना कुछ problem होता है, or they may lose a child after some time, or the child will go very far away once it is grown. So ऐसे भी हो सकता है. Yes.
So the next question is, are there any remedies, ma'am?
Well, definitely we strictly don't recommend. We strictly don't recommend the marriage between such. Agar if it is a very strong love marriage, then there is some of the exceptions, because when it is said that when Manokuta, agar join ho gaya, Manokuta seri bitre alli yaude dosha illa anta. because the karma paka will take over. Yes. So in such conditions, according to Vedas, my guru definitely does 1 or 2 pujas for that. And, it can be continued. Otherwise, we generally don't recommend.
Thank you, ma'am. Next question is to Swartha, ma'am. Ma'am, kindly justify alkaline pH of semen. Is it Ruksha?
Yes. So when we look into the pH of any substance, we know that there's acidic, alkaline, and neutral. So of course, like anything beyond, like above neutral, is considered to be as alkaline, and that is exactly where the normal pH of a semen, like of a seminal fluid is, which is exactly to precise, it is around 7.2 to 7.8. So roughly you can say it is like around 7 to 8, because depending upon the like ahara and vihara, depending upon the desha of where the individual is living, the pH can still differ, and it could be around like 9 physiologically also. But apart from that, a person living in a area wherein the pH is like should be around 8 to around 7 to 8, and because of his like ahara, especially that is like the ruksha ahara, so like if at all the pH happens to be more than that, so around 9 or 10, then that is considered to be as rukshata. So wherein like this is just a seminal finding that we consider to be as the macroscopic finding. But when you look into the like the microscopic findings, then in such individuals, you're also going to find vata dushti. So that is how it is considered to be as ruksha. Like rukshata is considered when there is increased or like alkaline pH of seminal fluid is. Thank you.
Thank you, ma'am. Ma'am, the next question is open for all. What is the ideal time for giving vaccinations like Japanese encephalitis or yellow fever? Ma'am, can a lady identify ectopic pregnancy by herself? Herself.
Ectopic pregnancy, she cannot identify. So whenever a pregnant woman reports with a period of amenorrhea, pain abdomen. So there is a chronic ectopic and acute ectopic. Right? So when she has a unilateral pain with the period of amenorrhea and a diagnosed case of pregnancy with symptoms of acute pain abdomen, she has to report to her gynae. That's it. She cannot herself diagnose. If at all, it may be with PV bleeding, with may not PV bleeding. So likewise, pain abdomen is the main feature in which in early pregnancy, again, it can vary right from early conception, even right from chemical pregnancy till 12 weeks, it can vary ectopics.
Yes, ma'am. Thank you. The last question, ma'am. This is to Sapna, ma'am. Which raga is best to hear during pregnancy time?
Well, it comes under actually music therapy, but any melody is always pleasant. Okay, any melodious music, if it is really heard by a pregnant lady, as ma'am said, it helps in relieving her stress also, and definitely just like a color therapy, as yesterday there was a wonderful lecture. So like that, even the music can also have a very strong impact on soothing the nerves of a baby, and the baby will really enjoy. In Japan, they have done a lot of research in the 3D dimensional, the investigations or research also, that how a music has really impacted on a pregnant lady, and they've done a follow-up of a child growth also later. So they were very sober and they were listening to their parents. So all such things they have found. So it has got an effect.
I think we can add some mantras will be chanted, no, like on day-to-day basis. That will definitely have some effect. Mantra therapy, it is called that, and various mantras we can use in Ayurvedic classics also. Few mantras are given.
Thank you, ma'am. Now I thank all the dignitaries for joining us for this panel discussion. Now we'll proceed with the valedictory function. So I request you all to occupy the chairs. Thank you so much.
A very good evening to all of you. Success isn't just about what we accomplish, it's also about what we inspire others to do. With a hope in our hearts that all our efforts have sown seeds of inspiration in your minds and heart, with mixed feelings of joy and sorrow, we have come to the end of Janani 2023. A very good evening to one and all gathered here. Myself, Dr. Anusha, Assistant Professor, Department of Shalyatantra.
This is Dr. Shivani, PG Scholar, Department of Rasayana Evam Vajikirana. Welcome you all to the valedictory ceremony of Janani 2023.
To begin with the ceremony, we request Dr. Suhas Kumar Shetty, Dr. P.G. Jadar, and Dr. Girija Staniko to escort the distinguished guest, Dr. Saubhagya Bhatt and Dr. Hemant Toshikane, to the dais.
Music is the prayer that heart sings. I call upon Miss Neha and Miss Sakshi to invoke the blessings of Almighty.
जय जय हे भगवती सुर भारती तव चरणौ प्रणमामः। जय जय हे भगवती सुर भारती तव चरणौ प्रणमामः। नाद ब्रह्ममयी जय वागीश्वरी, नाद ब्रह्ममयी जय वागीश्वरी, शरणं ते गच्छामः, शरणं ते गच्छामः। जय जय हे भगवती सुरभारती तव चरणौ प्रणमामः। त्वमसि शरण्या त्रिभुवनधन्या सुरमुनिवन्दितचरणा, नवरसमधुरा कविता मुखरा स्मितरुचिरुचिराभरणा। जय जय हे भगवती सुरभारती तव चरणौ प्रणमामः। आसीना भव मानसहंसे, आसीना भव मानसहंसे, कुन्दतुहिन शशिधवले, हरसरतां कुरु बोधिविकासं, सितपङ्कजतनु विमले। जय जय हे भगवती सुरभारती तव चरणौ प्रणमामः, तव चरणौ प्रणमामः।
Thank you, Ms. Neha and Ms. Sakshi. May I now request Dr. Swartha Open, Assistant Professor, Department of Kaya Chikitsa, for the welcome address.
It is very precisely said that every story has an end, but in life, every end is the beginning of something else. Just as it happens in conception, that the cells undergo constant degeneration and regeneration. Today, we are gathered here to mark an end to the guiding symposium JANANI-2023, Interdisciplinary Approach to Antenatal Care, and thus to have a promising beginning to the journey where we shall have applications of everything that we have learned so far in this amazing gathering. Good afternoon to one and all present here, respected luminaries on the dais and off the dais, esteemed chief guest, renowned guests of honor, adored principal, dean and vice principal, OS Janani, most valued delegates, cherished faculty members, and all dear students. It is indeed a beautiful moment, all soaked in the delighted frame, holding all the knowledge that was shared in the last 2 days. And in this moment, I feel extremely honored to welcome each and everyone to this valedictory program, but that which marks the beginning of interdisciplinary horizons. A great person is the one who can affect the minds of every generation and makes them feel that they too can become one. One such wise personality in our today's event is our chief guest, ma'am, Dr. Saubhagya Bhatt, consultant obstetrician and gynecologist associated with Patit's Fertility and Research Center, Belgavi. She is one of the brightest ray of light of the illuminating aura in the field of fertility and obstetric research. I feel overwhelmed to welcome you to this gathering, ma'am. It is a matter of great pleasure to have you amongst us today. I would now like to welcome a man of virtue, honor, and simplicity who is a living figure of admiration and wisdom. He is none other than our guest of honor, Dr. Hemant Toshikani Sir, Dean, Faculty of Ayurveda, Parul Institute of Ayurveda, Gujarat. Your presence has added inspiration, purity, and happiness to this gathering. I welcome you, sir. I present an heartwarming welcome to an accomplished professional and a beacon of, sorry, it would have been a great pleasure for us to have Dr. Ganachari sir here, but due to some situations, he was unable to be. We are all aware that success depends on the backbone of the institution, our adored principal. He is the one to manage, coordinate, guide, and supervise all the activities of our institution, which makes it to shine. I take great honor to welcome the president of today's event, Dr. Suhas Kumar Shetty. Another power bank of encouragement and enthusiasm that keeps our institution ongoing is our Dean and Vice Principal, Dr. Prashant G. Jadar, sir. I welcome you, sir. There is no limit to what a woman can accomplish. A very much witnessed representation of this is the Organizing Secretary of JANANI-2023, Dr. Girija Sanikov, HOD, Department of Prasuti Tantra and Stri Rog. I feel extremely happy to welcome you, ma'am, once again to this gathering. I would like to welcome all the happy and hopefully content delegates of Janani 2023. The wisdom that you have experienced in this symposium may stay along with you throughout your journey. I would like to welcome all the organizers who have been striving hard to make this symposium of what it stands today. You have hunted the dreams of every individual of the institution and made it into a real picture of Janani 2023. I also welcome all the industrial sponsors to this gathering. I extend warm welcome to this concluding event. Thank you.
Thank you, Dr. Swarda. I now request our principal, Dr. Suhas Kumar Shetty, to welcome Chief Guest Dr. Saubhagya Bhatt with a sapling. May I also request, sir, to welcome Guest of Honor, Dr. Hemant Toshikane, sir.
I now call upon Dr. Jeenu to welcome our beloved principal, sir, Dr. Suhas Kumar Shetty. Dean PG Jadar, sir. Organizing Secretary, Dr. Girija Sanikov, Janani 2023.
Thank you all. Moving on, I call upon Dr. Girija Sanikov, Professor and Head, Department of Prasuti Tantra and Stri Roga, Kahirshi BMK Ayurved Mahavidyalaya, and Organizing Secretary, Janani 2023, to reflect back on the highlights of Janani 2023.
A very good evening to everyone present here. I don't know how to start this particular event. So it's been the idea of conducting this symposium. It started in our mind 2 months ago. Then the idea was initially conceived when I treated one of the case of color therapy who was a speaker for one of this symposium, Dr. Ritu Lad. Then it started striking in mind that so color therapy can be one thing. Then later on, I happened to attend a talk of Dr. Sapna ma'am in one of the guest speakers. Then it started like so because every year what we do is we give the calendar of the proposed activities in the month of October and November, and we were due for one event to be conducted from our department. Then it so happened that this symposium was a thing where we could plan. Then the journey started like it started. Like so I started working on the areas where all we can include. Then it took a shape like where around 8 to 9 areas I could work and could identify some resource persons. This is how it started. Then we would, right? So we could finalize the areas like Ayurveda was anyways we had. Then the physiotherapy was very much available. She was very close and we had many discussions and integrated many protocols with our in-house physiotherapy department. There also we could work and how it was materialized. Then the dental was again, we could discuss where all we can include. And there was a thought like where in preterm labor we have many dental or gum problems. That's how a dental was considered. Then the astrology, no doubt it was. Then there was again a standard antenatal care, and there are many things where there are many practitioners where antenatally vaccines are a question nowadays, because nowadays we are witnessing even the TT, some patients are not receiving TT or the doctor is not bothered only. So likewise, the vaccination was into my mind. Then MTP, there are many areas where MTP pills and incomplete abortions, these we are witnessing nowadays. So we thought the updates on MTP could have been also be added so as to touch upon the standard antenatal care. So likewise, these areas were materialized. Then on July 29th, we launched the first brochure of Janani 2023. Right. So for this, we had a very overwhelming and enormous response, wherein around 332 were the registered participants. Then around 50 colleges across participated. And till now, we have received around 168 oral paper presentations from PhD, PG, as well as faculty categories. Then yesterday, we had the grand inauguration, which was led by NCISM officials. Dr. Dio Pujari, he's a chairman of NCISM New Delhi. Again, led by Dr. B. Srinivas Prasad, President Board of Ayurveda. He was a guest of honor. And Dr. Sujata Kadam, Dean and Academic Affairs from All India Institute of Goa, were the guests of honor for this particular. And again, this was led by Vice Chancellor and Registrar Sir and Principal Sir and Dean of Faculty of Ayurveda. Then yesterday, we had 9 plenary sessions and parallel paper presentations were conducted. Then today we had 7 plenary sessions and hope, right? So every session has been, right, so useful. And I think this particular symposium is going to pave a way for many, right? So many things must be coming to you in your mind. And again, since we are not seeing the pregnancy as it was before, right? As rightly mentioned by Dr. Anita ma'am today in her talk, like thyroid, right? So even it is the same experience with me. I wasn't seeing a case of thyroid or evaluation of thyroid T3, T4, TSH 10 years back. So now it is every second case where we need to rule out TSH. And again, every TSH is around 8, 9, 10, 24. The other day I had 120 TSH of the thyroid early pregnancy. So likewise, this trend is changing, or many factors are there, metabolic factors, many factors are. So it is a day where we need to embrace different disciplines. And again, patients are also ready to accept the things when we are orienting to them. Right? So with this hope, with this, it has enriched your knowledge. And again, your thought process must be changing. Right? So with this, I conclude my report reading. Thank you.
Thank you, ma'am. Good feedback is the key to inspiration as well as improvement. It's now time to hear from our dear delegates and resource persons. First, I'd like to call upon stage Dr. Anita Halgatti, Professor and Head, Department of Prasuti Tantra and Stri Roga, Ayurveda Mahavidyalaya Hubli, to share her views regarding Janani 2023.
Good afternoon, respected delegates on the dais and all the dais and dear students. It is very heart-touching moment and very memorable moment for me being a part of this event today. And I wholeheartedly thank all the organizers of the Janani team and the principal sir and all the members of the Kaylee Society for giving me this opportunity here. And in our classics Ayurveda, Masanomastika Garbhini Paricharya is told by giving different Ayurvedic medicines in each month. Like that here, what I felt today, the Garbhini Paricharya is totally completed by the Janani Symposium here. Because today, yesterday's session I missed, but today, what I have come across today, the different multiple knowledges from different angles I enjoyed really. It is because of the chief organizer or the chairman of the event, Dr. Girja Sanikop. the thought what came in her mind, it is really fulfilled and completed in this occasion. So I wholeheartedly thank and congratulate for successfully conducting this event to the whole team. Thank you.
Thank you, ma'am. I now call Dr. Komal Itkari, Assistant Professor, Department of Rasayana and Vajikarana, NKJ Ayurveda College, Bidar, for the feedback.
Good afternoon, everyone. I congratulate Girija ma'am and entire team of Janani 2023. It is indeed actually a proud moment being an alumni of this college. I've completed my UG and PG in this college. Everything which I had left here, it has grown to the utmost. It has the Janani, it has shown the how sophistication we maintain in KLE. It has opened the view of the students or the delegates who have come over here. Thank you so much, ma'am, for conducting such a topic in every aspect, because nowadays every person is doing as we see in different aspect. She here has given that we have to see in every aspect how a pregnancy affects and how we have to deal in this. The takeaway message to entire delegates, they have given it that you have to see in all perspective. And here, which my students have come with me, I had said them that you have to see how a KLE organizes the event. Some of the PG scholars and UG scholars have come with me with my college, and I hope they have enlightened and they got the message how to conduct the seminars and how you have to inculcate everything. Thank you so much, and thank you for inviting me. Thank you.
Thank you, Dr. Komal. I call upon Dr. Aditya Gaitonde, Mr. Aditya Gaitonde, UG Scholar, NKJ Ayurveda College, Bidar.
Good afternoon, everyone. Respected dignitaries on the dais. It gives me immense pleasure to stand in front of you all in the KLE Institute. As ma'am has rightly mentioned, I am her student. She was telling me all through her journey about her memories and all. Today I felt what KLE means. We talk about global world, and KLE has taken the first initiation of globalization of Ayurveda. It makes really happy, and it is an eye opener for all the Ayurveda fraternity. It teaches how Ayurveda legacy has to be taken there. I congratulate all the Janani team. Keep doing such seminars and inviting us. We will all be encouraged and enlightened. Thank you so much.
It's now time for the release of Peace Honor. I request all the dignitaries to do the honors. I request Dr. Naina Bhagat, Assistant Professor, Department of PTSR, to coordinate. Articles, Lecturers 8, Students 20, Invitees 1, Abstract, Lecturers 2, Students 97, Puzzles, Students 3, Message from the VIP 7, Success Stories 2. Thank you. Moving ahead, we are honored to have with us leader who revolutionized Ayurveda education in Gujarat, Dr. Hemant Toshikani, Dean Faculty of Ayurveda, Parul University, Gujarat. I request Dr. Jayasheela Goni, Professor, Department of Prasuti Tantra and Stree Roga, to introduce her to the gathering.
Good evening,
I
everyone.
request Dr. Hemant Toshikani to occupy the felicitation chair. We also request the dignitaries to join the felicitation ceremony.
Good evening, everyone. It's my pleasure to introduce our guest of honor, Dr. Hemant Toshikane, Dean Faculty of Ayurveda, Parul University, who has graciously accepted our invitation to join us today. He is a highly accomplished individual in the field of Ayurveda. He is known for his wonderful administration and high achievements of the institution. There is a saying, if your actions inspire others to dream more, learn more, do more, and become more, you are a leader. Dr. Hemant Toshikane is one such personality who always inspires others. Hemant sir he has achieved highly skilled education professional with over 25 years of leadership, and he works as IU Chair, West Indies, Trinidad and Tobago. And he's an adjunct faculty in Cam Akmal University, Hawaii. He's a recipient of more than 15 awards. One of them is Dhanvantari Puraskar 2021, Best Vaidya by Gujarat government. He has published 14 books. One of them is Sushruta Physics. Sir has completed 9 government and non-government projects guided by, and he has also guided 28 PG dissertations and 8 PhD thesis works, and more than 8 scientific presentation in national and international reviewer he is, and 9 national and international journal he has become as a reviewer, and 120 national and international publications he has done. And he has attended more than 80 events as a resource person. And he has developed more than 8 courses, and he has organized more than 20 events and 20 pipeline of, and he has done 13 patents. It's a big achievement. 13 patents are in pipeline. And with this, I introduced and I welcome to the session. Welcome to Janani 2023, sir. Thank you, sir.
Thank you all. May I now request Sir to speak a few words on this occasion.
Good evening, everybody. Good evening, everybody. Yeah, because it's valedictory. And I'm, as a guest, I'm here on the stage and I don't know what is the pulse of the audience, whether they are in receiving mood or not. Okay, everybody is alert. I wholeheartedly, I'm like very much happy, delighted to get honored. Always, no, everybody feels कि किसी को बहुत कुछ अच्छा बोल दिया किसी के बारे में तो definitely उसको internally feel होता है. ऐसे हमने कुछ ज़्यादा नहीं किया है, but it happens that we are in the profession, and once we are in the profession, things automatically happen, and that is what is Madam has told, and that has brought us this recognition. I thanks Dr. Suhas Kumar Shetty and his team for honoring me on this occasion. Thank you. Few days back, like it may be 15 days, I and Dr. Suhas, we talk on different occasions, and I was talking to him, and I told, I basically belong to Belgaum. Many of us are people who are here. They are our students or my colleagues, and they know me. And I visit Belgaum frequently. And I just told Suhas, I'm coming for some purpose. Then he told, you have to come for an program. Then I told, okay. So then he told, it is valedictory. I got an email. I accepted. I thought that it will be a very small program, and it will be in our Ayurveda college. But when I came yesterday, I was just looking, I went to college also. But then where is the program? They told, no, it is there in the big auditorium, so many people. So making this much arrangement, in the sense reaching so many people, like 360 registration, 166 paper presentation, definitely, because those who are there in administration, they know. We also organize many such programs. Reaching people, convincing them to make them participate is a major challenge, and which Dr. Swaz and Girija Madam and Prasut Tantra department team has done. Really, I congratulate you, Madam, for your effort. And I could able to hear by Girija Madam's report also with a few feedback from the audience also. What type of the deliberation it was, because I'm not belonging to Prasuti Tantra or Kaumar Vritya. I belong to Shalya Tantra, quite odd man. But still, I could able to make out the different presentations, like even in the panel discussion, I was there for a few minutes. There were questions on Jyotisha Shastra. There were questions on the Ek Nadi, what will happen. Kundali, and then there were also questions from genetics. So whatever areas which are related to the pregnancy and maternity, all these probably in these areas with the best of the best resource persons, it is being covered here, it is being taught, it is being informed, information is given. And always, I believe there are some teachers here and there are some postgraduate students. Can PGs can raise our hand? How many PGs are there? They can raise their hand. Very good number of PGs. Okay. So there are other teachers also. Some of our teachers are also our students. So what will happen when somebody speaks, when I'm speaking or somebody speaks a new topic, we feel very much interested. We feel this is possible, this can be done. And we feel we should start working on that immediately. But unfortunately, what will happen the moment the event is done, the moment we make so many notes, okay, now CD is released. And the moment everything is done, we go back to our place, we fit into our routine, then definitely we forget what was attended, what was done, and what was learned. So I hope by this, the audience in this hall are not of that type, and they definitely keep it in mind and they refer it, they read it, and they at least they take one area of this which was discussed here, and they go ahead, right? And when Dr. Suhas asked me to be a part of valedictory program. Always valedictory program में बात करना थोड़ा challenging होता है, because I know it. कॉमन जोक पता है ना, एक वैलिडिक्टरी सेम प्रोग्राम होता है, जैसे मेरे जैसे एक स्पीकर होते हैं, एंड प्रोग्राम आज तो मैं I counted there are 166 people in this hall. When I was sitting there, I was looking who are all there, and so 166 is good number, right? So एक ऐसे स्पीकर होता है, तो बात करते रहते हैं, तो देखते हैं सामने तो एक आदमी बैठा रहता है, तो वो तो बात करता है और उसको लगता है कि ये एटलीस्ट मैं एक को तो ज्ञान दे रहा हूँ करके, तो सब भाषण हो जाता है, तो पूछते आप तो बहुत इंटरेस्ट से बैठे थे, क्यों बैठे थे? नहीं सर, ये हॉल का प्यून मैं हूँ, इसके बाद आप जाने के बाद मुझे ताला लगाना है। तो मुझे तो ये तो नहीं, मतलब आप लोग इतना इंटरेस्टिंगली बैठे हो, तो डेफिनेटली एक ताली आप लोगों के लिए होना चाहिए। आई कांग्रेचुलेट यू ऑल for your interest, and this I was Suhas has given me 10 minutes, and I believe I will not cross 10 minutes. जैसे हम लोग बात कर रहे थे जननी like giving birth, right? I was also asking Aziz कि इसमें सिर्फ प्रसूति है, बाल रोग भी है, तो बोला प्रसूति के बाद बाल रोग आता है। बट आजकल क्या हुआ है, बाल रोग प्रसूति में मर्ज हो गया है कि now technology has changed to this extent कि there is an baby engineering, what I could able to read. There are many countries which is adopted baby engineering. Switzerland is one, France is one, which is adopted, where you can have a baby, what type of you can have a code a baby, you can genetically, you can design a baby, and it can be, a womb can be created and mother can give birth to that baby, like what type of skin color you are looking for, what type of hair color you are looking for, what type of eye color you are looking for, whether male or female, what height you are looking for, everything is possible. So technology has changed to this extent, and followed by earlier days, like when we say now what has happened is they were reading, no, in my biodata, they were reading. I worked as a chair for University of West Indies, and when I was in Trinidad, I used to see there. The population there is in minus. In India, we say population is very like we are first, no, in the world now. We have like crossed China recently in this year or last year. So 135 crores is our population, which is counted. Uncounted is also there. So India is something different, and that country has like in world, both the things are there. There are countries where very few births takes place or birth doesn't take place. In Netherlands, it's same situation. They need people. So always when a couple decides to have a baby, they always think what type of they need a healthy baby, they need a good baby. There are many things they think, right? And these all things they bring like when you plan a house, no, you go and meet an architect and you say, I need my bedroom here, I need my hall here, I need my something puja room here, everything like same way. Nowadays, the parents will come and meet a gynecologist or an obstetrician or the consultant. They will ask like, we all need these things. And every now and then the changes, the growth are monitored. There are by different ways. So as an Ayurveda doctors, we have our many roles. Like हम बताते हैं हमारे history में महाभारत में क्या था वो 100 अभिमन्यु का birth था नहीं he gave birth to 100 children, no? Gandhari, sorry. Gandhari, she gave birth to 100 children. So हम उसमें बोलते हैं कि ये सब test tube babies थे या in vitro fertilization. ऐसे बोलते हैं there is a theories. They say it was possible. And there were instant births also. There were one gender births also. In history, if you see, maybe that may be true. We cannot say it was not there because there are many evidences which say it was there. So when history, what it was there is not important. What is mentioned in Kashyap Samhita is not important. But what we execute is very important. आज का दिन हम क्या कर रहे हैं कि हम लोग ऐसे करके immediately आज कोई कल एक कपल आया, एक मम्मी आई और मदर बोली कि मुझे बेबी चाहिए, कल हम जनरेट करके देने वाले नहीं देने वाले, इट इज वेरी इंपॉर्टेंट. तो इसके लिए वी हैव टू हैव द नॉलेज ऑफ साइंस. सो वेरी इंपॉर्टेंट इज नॉलेज ऑफ साइंस, टेक्नोलॉजी, स्किल, एंड देन इट इज पॉसिबल. कमिंग डेज विल बी लाइक दैट. आजकल क्या है कि बच्चों को पता नहीं है, आप यू आस्क स्मॉल किड कि दे विल आस्क देयर मदर, मम्मी व्हेन आई वाज डाउनलोडेड. Fortunately, they don't ask when I was uploaded. Okay. Technology, because they know this is happening now. Now everybody is like that. Okay. By the time the baby comes out, it knows many things, many. So what I say is we have to adopt the technologies. We have to adopt the skills. We have to work in this area. Just I will give one example. There was one engineer, and that engineer was jobbed in a Second World War. He was a job in Second World War. एंड उसका जॉब था सेकेंड वर्ल्ड वॉर में कि जितने भी टैंकर्स होते हैं, टैंकर्स को उसको रिपेयर करना, उसका इंजन को रिपेयर करना. एंड सेकेंड वर्ल्ड वॉर खत्म हो गया. देन दिस इंजीनियर ही केम बैक टू इटली. जैसे इटली आ गया, देन उन्होंने क्या किया, he thought he will manufacture something with those tankers which are there in the war field. So he bought them. And जैसे उसको वापस इटली लेके आया, then he started one tractor company. And वो tractor company में ये engines को बिठा दिया. Then it become like very successful tractor company. जैसे successful हो गया, पैसा आ गया. Then उसको he thought he should have a high-end sports car. Then उस time sports car एक ही था, Ferrari. So this engineer, he purchased a Ferrari. And then what happened when he started driving the Ferrari? He was basically a mechanical engineer, and he has manufactured already so many such things. So he came to know that there is some problem with this vehicle, and its accelerator is not working, or its brake system is not good, or something can be modified. So he was an engineer. Like हमारे डॉक्टर भी ऐसे होते हैं ना, what we do कि जो डिसीज नहीं होता है उसको भी हम पैदा करते हैं पेशेंट के दिमाग में. So engineers are also like that. They find solutions for without having any problems. So in this situation also, he goes and meets the owner of the company, Ferrari, and he says, see that your vehicle is very good, extremely good, but these needs to be corrected. If you correct this, probably your vehicle will be the best one. That is a typical corporate house. They decide, they listen to him. They think he's a man without any work. He has come to give suggestions. They don't consider his suggestions. They say, okay, we know it, what to do. We have already done what best we can do. Our engineers are best on this earth. They have done everything. You need not to suggest anything. Then this boy, he goes back. This man, he goes back and he takes it as a challenge. He thinks, why I cannot manufacture a sports car? Why I cannot manufacture a fancy car? Then he himself manufactures a car. Okay. And his car name was Lamborghini. And now his car was far better than the earlier company car, and he creates a competition. He was a competitor, and lot of things has happened afterwards. Why I am telling, whenever suggestions come, whenever something learning issue comes, we should not limit ourselves. We should adopt it and we should learn. Same thing with whether it is genetics, whether it is our Garbha Samskara, whether it is Jyotisha, whatever it is, like when it comes to Prasutantra. Because what is happening situation in concern with Ayurveda, because I had an institution and I have worked in KLE Belgaum for some years. I have seen so many organizations. The obstetric work has reduced in many of Ayurveda institutions. Gynec work is okay. Obstetric works, definitely it has come down because of government has so many schemes. In my place in Gujarat, there is a scheme like if a pregnant woman goes, all things they do free of cost. Over and above, they give some money. Over and above, they give them blanket. Over and above, they give them ghee, rava. So many things they give. So that patient, they don't prefer to go such organization where such all facilities are not there. And there is so getting obstetric cases for an Ayurveda hospital is a challenge, right? But it is not here. I know, like when I was working here in Shalyatantra, in Prasutantra, Girija Madam has joined. And that time we used to have a competition for OT, whether they have to do their scissor or we have to operate our case. So I know it. So probably now their intention is to start post-graduation in Prasuti Tantra. And for that, I heard that Suhas has planned to have one discussion, and it's a very good platform what he did. When we applied first time post-graduation in this institution, that time also we applied for Prasuti Tantra almost 10 years back, what I believe. And that time there were absolutely no teachers. But now availability of teachers, availability of facility, and now they are in the process also, they will going to get their post-graduation in Prasuti Tantra. And those who are there postgraduate scholars of Prasuti Tantra, you may be aware कि आजकल आयुर्वेद में जो टॉप पोस्ट ग्रेजुएशन एडमिशन है वो स्त्री रोग एंड प्रसूति तंत्र पीटीएस है ना कि मेरे पास आई हैव 12 सीट्स इन प्रसूति तंत्र एंड स्त्री रोग. So everybody whose call I receive, everybody whose influence I get, everybody who comes to me, 99% of the time, first he asks Prasuti Tantra, second they ask Shalya Tantra. So much high demanded subject it is there. So when you cream students, they go, when with an interest they go, so it is all our responsibility, like learn simultaneously, grow and give something to Ayurveda science. And we need not to compete with the Western medical science. We can have our own channel. We can complement each other and we can grow. So I, once again, thanks to the whole, these organizers for giving me an opportunity to be here and to address you. Thank you.
Thank you, sir, for those amazing words of inspiration. We have now reached the moment the delegates most wait for. I call upon Dr. Ramesh Kilidar, Associate Professor, Department of Prasuti Tantra and Stri Roga, to coordinate the prize distribution of oral presentations.
Good evening, all. A famous quotation from Shushruta Samhita says, Ekam Shastram Adhyano na Vidyat Shastra Nischayam Tasmat Bhushuta Shastram Vijaniyat Chikitsaka. So which emphasize that the importance of interdisciplinary approach in the management of any disease or concept. So with this intention, various themes of Janani 2023 were set for the oral presentations. I feel happy to announce the best oral paper presentation of Janani 2023 National Symposium on Interdisciplinary Approach towards Antenatal Care. A total of 168 abstracts were received and paper presentation were conducted in both online and offline mode. 16 presentation were on online mode, which was conducted on 6th September, and 152 were offline and conducted in 10 parallel sessions. So best paper in online presentation mode was divided into PG and faculty. And among faculty, I announced Dr. Sipika Swati, who is a faculty, ITRA Jamnagar, bagged the first prize. And among the PG, Dr. Vedasri, DT, PG scholar, Department of Panchakarma, SDM, Udupi, bagged the first prize in a PG. Then scientific oral paper presentation in offline mode was conducted on 8th evening in 10 parallel sessions. So session first, which was from the faculty. So I announced that Dr. Satish Jalihal, who is a professor in the Prasuti in the Stiroga, BVS AMC Bagalkot, bagged the first prize with the topic Role of Putriya Karana in the Management of Putragni Yoni Vapar with special reference to prevention of abortions. So sir is not there. So from Bagalkot, anyone is there? So on behalf of sir, madam will receive the best oral paper presentation. I ask Dr. Hemant Shikane sir to present the memento and a certificate. So session 2, which was from PGs, Dr. Majike Apeksha Ashok bagged the prize, first prize, with the topic Ayurveda approach in the management of Hikisa from Kaya Chikisa department, Kaya Sri BMK Ayurveda Mahavidyalaya. From the session 3, Dr. Kiran B. Ganagir bagged the first prize. The topic pre-conception role of Ayurveda and its importance in achieving pregnancy with special reference to Bija, a case report from the Department of Rasayan Vajikarna, Kaya Sri BMK Ayurveda Mahavidyalaya. From the session 4, Dr. G. Pratyusha bagged the first prize. The topic Kshirapaka Kalpas in Masano Masika Garbhini Paricharya is special reference to 8 months from the Department of Rashastra and Vaishesha Kalpana, KL Shri BMK Ayurveda Mahavidyalaya. Ask Dr. Jadhav sir to present. From session 5, Dr. Dalal Dimple Divesh, role of Anuvasana Basti and Yoni Pichu in the pregnancy for normal labor from the Department of Panchakarma, Kaya Sri BMK Ayurveda Mahavidyalaya. Anyone from Panchakarma department or their PG friends can receive the memento and certificate. So in the session 6, Dr. Vimarsha Vinayak Bhatlatkar bagged the first prize. So application of Garbhapala Rasa in pregnancy from the Department of Rashastra and Vaishesha Kalpana, Kaya Sri BMK Ayurveda Mahavidyalaya. From the session 7, Dr. Shruti R. Shulharti Varti in the post LCS pain management, a pilot study on a rectal suppository from the Department of Prasuti and Stri Roga, Sri Kalabhaireshwara Ayurvedic Medical College, Bangalore. And session 8, Dr. Bhumika S. The topic Understanding Folklore Formulation in the Postnatal Care from Southern Western Ghat Foot Hills, a conceptual study from Department of Rashastra, Kaya Sri BMK Ayurveda Mahavidyalaya. And session 9, which was from UG, Prachi Gad from the BSP's Gomantak Ayurveda Mahavidyalaya Research Center, Shiroda, Goa, bagged the first prize. A review study on Sudhika Paricharya in relation to Yonigata Vata Shamana. I request sir to give the certificate memento. And session 10, Dr. Meghana Ganti from the Department of Dravaguna, Kaya Sri BMK Ayurveda Mahavidyalaya, Vishada in pregnancy, hoping she is not alone. So I ask sir to give certificate and memento. So with this, I would like to thank all the chairperson for chairing the session and nominating the best paper presentation. With this, I'll end the thing. Thank you one and all.
Thank you, sir. Hearty congratulations to all the winners. The team of Janani 2023 is grateful to honor the sponsors for their unconditional support and successful conduction of the event. I request the representatives of the sponsors to come ahead and accept the token of gratitude. I request Dr. B.G. Jadar sir to do the honors. Palay Pharmacy. Palay Pharmacy. Jandu Pharmacy. Chaitanya Pharmacy. Kaylee Ayurveda Pharmacy. Kaylee Ayurveda Pharmacy. Thank you, sir.
We are blessed to have with us as chief guest a woman who has stood strong for the health of women for 4 decades, a leader by example, Dr. Saubhagya Bhatt, consultant obstetrician and gynecologist, Patets Fertility and Research Center, Belgavi. I request Dr. Reshma Salimani to introduce our chief guest to the gathering.
Good afternoon to one and all. It is my immense pleasure to introduce the dynamic personality in the field of obstetric and gynecology, Dr. Saubhagya Bhatt. Ma'am pursued her MBBS and MD from Bangalore Medical College. Ma'am started her career at Kaspegar Medical Clinic in the year 1986 as a consultant in Obs and Gynae department. After the great successful journey of 34 years, she is presently working as a consultant in Patets Fertility and Research Center. To her honor, ma'am is former president of Belgium Obstetric and Gynecology Association and also Family Planning Association of India. Ma'am has expertise interest in maternal and child health, ultrasonography, and the most challenging area in the management of high-risk obstetrics. Ma'am is also recognized for her selfless social service, where she conducted many camps in rural area with the intention to prevent female feticides, to create awareness about HIV prevention and safe abortion, and also to educate women regarding anemia. Ma'am has enlightened so many school and college students by delivering lectures regarding sexual health and life skills. With this short and sweet introduction, I welcome you, ma'am. We feel honored to felicitate you in this JANANI 2023 National Symposium. Thank you.
Thank you, everyone. I now request ma'am to address the gathering.
Good evening, everybody. And dignitaries on the dais and delegates off the dais. I'm really overwhelmed. I didn't expect a felicitation today, but I think it's a reward for the 34 years of my obstetric journey that I have done to the best of my capacity. It's very interesting to know that I belong to a generation where fingers talked, eyes saw, and the history was something which was very, very important. As an undergraduate and postgraduate student of Bangalore Medical College, way back in 1980s, there was no ultrasonography machine. Believe it or not, we had to do everything with a stethoscope and the grips and the way we do the external ballotment. That was all that was taught to us. And I can proudly say today, we didn't do much mistakes. I can identify only
a few mistakes that we have done is that for molar pregnancy, a patient would be in the ward for days together with bleeding, spotting, on and off. Everybody would write external ballotment positive. And would say, yeah, one monkey falls, the other falls. The next PG also writes the same, EB plus. And to the dismay one day when she throws the moles on the bed, we had to bend our head in shame. That was the situation. And missed abortion cases, we didn't know what we missed. Whether the baby is missed or we have missed in the diagnosis. Wait and watch was the principle those days. And only when it was 12 weeks, uterus becomes palpable. We are very happy to say it's growing. And at that stage, we started our practice, and our teachers were strict taskmasters. Whenever we were examining the patient, they would be standing and watching us. Anybody who went straight to the abdomen of the patient would be thrown out, because woman is not just there to deliver a baby. You have to examine her from head to foot. Head to toe examination was a must, and that's how we learned our practice. And the stethoscope would speak volumes about the fetal monitor, what we are seeing. We would diagnose. Variable FHR, we would know. We would know the position of the baby by knowing the position where the fetal heart is, whether it is breech, whether it is transverse, whether it is occipito posterior, occipito anterior. Everything we knew by the position of the fetal heart rate. But I'm sorry to say that stethoscope is something which is forgotten by the present day practitioners, or even the new generation doctors who are coming. And I always thought, why people only auscultate the fetal heart? There is a mother who's got a heart which is beating so much. Why her heart is not examined at all? This is what is happening. And I request the new generation, please hold your step in your hands and then go near the patient. Don't delete yourself off the stethoscope, because it is our staff nurse who are using the steth more than us now. Don't you think so? Because she is the one who checks the BP. She is the one who is doing everything. Our duty is just go put a Doppler. For the sake of the patient, we are making her hear the sound so that the patient is very happy listening to the heartbeat. But that should not be the case. We may miss some cases of still the rheumatic heart disease that may be present. Recently, we did have 2 or 3 cases of rheumatic heart disease, which may be there and which we think is not there. So that, if missed, can become a catastrophe to the woman who is going to deliver. So this is the basis of our antenatal care. And the antenatal care is so important, whether it is Ayurvedic kind of practice, homeopathy or allopathy. We are looking at the woman with the fetus inside, and the outcomes should be the best. So we need to have a very good antenatal care. From then to now, there has been so much of change. Then a woman's death, of course, we would mourn the woman's death, especially when Vani Villas, where I was practicing. Patient would come in the last moment and she would deliver on the wheelchair. If at all we get a stretcher, well and good, she's lucky. Or in the receiving ward, she would deliver. Sometimes it would be face presentation. On the floor, we would conduct the delivery. Somehow we managed to pull the baby because there won't be any beds. Or with a rupture uterus, forceps in situ. And then we do an emergency section. That was the situation. And hand prolapse. I have not seen any hand prolapse now. So there has been so much of change, and that change is only because of the ultrasonography and the antenatal care that we are giving today. And the antenatal care was not there way back, because people thought, why do we need obstetrician? Gravity acts, nature acts, baby comes out. What business does a doctor have? Once you go to a doctor, she'll do cesarean section. And there is always an old grandmother or great grandmother telling, don't go to doctors. If you eat medicines that they give, baby becomes big. And then they will do cesarean section, they fill the pockets. That was the thought. But now the things are changing, and every pregnancy is counted. Every pregnancy is by choice and not by chance. And it is our duty to save each and every mother and the child. So the antenatal care is so important that the status of a country depends upon the maternal mortality. So the better the maternal, lesser the maternal mortality, it is a developed country. Believe it or not, in the US, the maternal mortality is only 21 per 1 lakh. And that too, those deaths are only because of non-preventable causes, like amniotic fluid embolism. Those things, it's not in anybody's hands. So those deaths are seen. But in India, with so many 135 crores population, our death is today, as of now, March 23rd, is 97 per 1 lakh. But of course, it's quite encouraging to learn that it was in 3 digits way back in 2018, and now it's not way back, it's about 5 years ago. It was in 132. Now it has come down to 97, and our aim is to reduce to 70 by 2030. If we can, how can we do this? It's only by regular patient and health worker contact. If we have that, only we can have and a multidisciplinary application that all of you know about it. And there has been a mind-boggling discussion going on for the last 2 days. And it was very interesting to see all the topics. And I wish I had registered for this because, you know, ultimately, science is science. Ayurveda is also a science. Probably there is not as much as evidence. I am not very sure. The evidence that the allopathy or the Western medicine gives may not be there in Ayurveda. Probably that is one of the reasons why it has not become so popular, but it is taking, a lot of, it's becoming quite, what to say, a mode of treatment in many of the Western world. Also, it is gaining popularity. And so I think there is nothing we should work. It can't be supplemented. We have to be complementary with each other. The different disciplines should be complementary with each other and work. And so the maternal mortality of Karnataka, if you want to know, it is 79. As of now, it is 79, and it was really bad. And then we have worked very, very hard, conducting so many programs and public-private partnerships with the government. We have worked, and then we have had regular antenatal care. And there should be actually 8 contacts. In a private setup now where I'm working, as Dr. Hemant said, we know when it is downloaded, but I know now when it is uploaded too, because I'm now working in a fertility center. We know when the embryo is transferred. So we know the uploading time, we know the downloading time, and in the in-between time, what we do is very important. And so we have regular antenatal checkups have reduced the perinatal deaths by 8 in 1,000. So if there are 8 contacts, minimum 8 contacts between the mother and the baby, we can reduce the perinatal mortality to a great extent. And our infant mortality is 20 per 1 lakh, and that should also not happen. So our women basically are anemic, and the major reason for death is anemia, which sometimes hemorrhage. A normal woman with good anemia, good hemoglobin can withstand the hemorrhage. But what about the poor lady who's got 7 grams hemoglobin? She will die even with the normal blood loss. This is where we are lacking, and the anemia prevention program should be emphasized. And I don't believe in starting anything once the woman gets pregnant. We have to do it at the preconceptional state itself. And many women don't reach us at that time. So what should we do? Tackle the adolescents, go to the schools. That's what I did. For many years, I did school programs where we talk about anemia, we call the mothers, we talk about about the nutrition, about the deworming, about the good food that the children should eat. Potable drinking water is one thing which is needed to prevent the anemia. So once the adolescent girl grows into a healthy woman, she will be sufficient in amount of iron and calcium. So our job becomes very, very minimal. Don't you think so? So I think we should tackle at the adolescent level and then talk to people to take regular antenatal checkups with ultrasonography, which is the third eye. It is a Shiva. I call it as a Shiva Shakti. Our Prime Minister is calling the South Pole of the moon as Shiva Shakti, but I call it ultrasonography because it's a third eye. What we don't see, ultrasonography machine gives so much of information. And when I started practicing in Kasbekar Medical Clinic, we did have a 2D ultrasound with a heavy linear probe. It was so heavy and my little hand couldn't hold it. It was so heavy. Now we get quite a dainty one, and then, we get so much of information. At 6 weeks, we see the heart beating, and probably Dr. Manjunath Hukkeri would have, the right person to do it, would have told you so many advantages of having an ultrasonography. It will sort of give the horoscope of the baby as such and helps us to identify a problem which can be either tackled or terminated. Because sometimes when we did conduct deliveries, the abnormal baby would come out to our dismay, and we wouldn't know what to tell the patient because we wouldn't even know that she's carrying an abnormal baby. Or if there is a breech presentation where the head is not coming out, we would think, this could be hydrocephalus, and that's why we are not able to pull out the baby, and then do the spinal tapping and whatnot, and evisceration, whatnot we've done, and which you have not heard of. This generation hasn't heard of all the destructive surgeries that were done once upon a time. So from then to now, we are having so much of safety in even conducting mid-trimester abortion if there is an abnormality. Earlier days, we were putting all these ethacridine lactate, saline, or even hypertonic dextrose and trying to deliver. In the process, so many women were dying because of the embolism. So, but now we have got our wonderful prostaglandin, which is a new drug, which will do the job for us. So there has been so much of change, so much of learning, and everything should be learned to the best. And I was very much interested in color therapy. And I was just thinking, recounting our pregnant ladies are given green saris. There is a reason. I don't know if there is a person who has already given a talk that green takes the least amount of energy, and it is very pleasant, and the nature is green. And we are in the nature. And that will go a long way in keeping the woman happy, and the blood circulation improves. And all our traditions that are done, like we do that kupsa and all those things, keep the woman pampered and happy. It's all because the serotonin and endorphins are released, and thereby the circulation to the baby is improved. And the 7th month OT, we wear the bangles here, the green tight bangles. That also, by the 7th month, the baby uterus is growing bigger, and there is regurgitation and acidity. And this is supposed to be a point which reduces the nausea and vomiting, the point here. So there is so much of scientific knowledge in our ancestors, and we are not doing anything great. Maybe we are finding it out. And our Kauravas could be either the embryo stored, or it could be the cloning. And our Pandavas who came out could be parthenogenetic. I don't know. Yesterday I was just reading in one of the papers that without the egg and the sperm, they have developed an embryo in one of the Western countries. So this is like something like a parthenogenesis. Probably it was already there, and we are rediscovering, relearning. So there is so much to do in our antenatal practice, and we should bring down the maternal mortality and the infant mortality to a great number so that India becomes a developed country. Now, no number of going to the moon or going to the sun is not going to give us the status unless and until we women work, or we doctors work towards it. India cannot reach that state. And with these few words, I thank you all for giving me this opportunity to share the dais with you all. Thank you so much.
It takes both sides to build a bridge. Thank you, ma'am, for giving out this message that blending the ancient knowledge to modern technology would probably be the right way of ensuring a smooth journey for the Janani.
We are happy to announce the next compendium, a national workshop, Kriya Arohana, which is intended to bring hands-on exposure of Nadi Pariksha and Prakriti, a first of its kind being organized by KLE Ayurved. I call upon Dr. Vinod Gurav, Dr. Usharani Sanu, and Dr. Kadambari Sagri, Department of Kriya Sharira, to coordinate the release of the first call letter of Kriya Arohana. I request the dignitaries to join the speech.
Thank you, everyone. Coming together is the beginning, keeping together is progress, working together is success. It's now time to honor the key contributors of Janani 2023. I call upon the faculty of Department of Prasuti Tantra and Stri Roga to the dais. Dr. Girija Sanigop, Professor and Head, Department of Prasuti Tantra. Dr. Jaishila Goni, Professor. Dr. Ramesh Kiledar, Associate Professor. Dr. Gayatri Hubli, Assistant Professor. Dr. Nayana Bhagat, Assistant Professor, as well as Dr. Reshma Salimani, Assistant Professor.
Thank you, sir. Leadership is the capacity to translate vision into reality. I request our ever supportive, beloved principal, sir, Dr. Suhas Kumar Shetty, for the presidential address.
A very good evening to all of you. On behalf of the KLE Academy of Higher Education Research and KLE Sri BM Kankanwadi Ayurveda Mahavidyalaya Belgavi, I'm really feeling proud and satisfied at the end of this 2 days National Symposium on the Interdisciplinary Approach towards Antenatal Care. It's a great matter of pride to the institution, which happens to be the first Ayush institution to be NAC and NABH accredited, where we are celebrating 90 glorious years of Ayurvedic education, healthcare services, and research, and also celebrating 25 years of our post-graduation studies in this KLE Ayurveda. We have already 10 departments in post-graduation studies, and hopefully, with the approval of NCSM, we'll be adding 2 more post-graduation departments to our institution, and that is the Department of Prasuti Tantra and Stiroga and the Department of Rog Nidana and Vikriti Vijnana. And of course, maybe shortly we'll also add few more, and one in such is the Department of Kriya Sharira, which will be maybe shortly we'll like to go for the post-graduation department in Kriya Sharira and Samhita and Siddhanta also in the near future. It always been a great matter of pride to conduct such symposium, and we're always thankful to our Honorable Chancellor, Dr. Prabhakar Kore, and our Vice Chancellor, Dr. Nitin Gangane, Honorable Registrar, Dr. M.S. Ganachari, sir, who has graced this occasion, has always been supporting to conduct such activities in our institution. It never would have been possible without the great efforts of the entire team, which took a lot of interest in organizing this particular program, and special appreciation to all the faculty members of Department of Prasuti Tantra and Stiroga, led by Dr. Girija Sanikop. They have been trying to plan very well, making the best efforts to see that we are able to reach maximum number of people And as a part of these efforts, we are evident that we had more than 332 registration from more than 13 states spanning from more than 26 institutions, which speaks that we are able to reach many, many people who are really enthusiastic to learn about the new development happening in different areas of the teaching, learning, and research. Uh, Almost every other day we used to discuss regarding the planning of this particular program and how best we were able to execute this entire program. And it was an array of different domains that were being selected by the organizing committee, where we tried to touch all the aspects from maybe Ayurveda, modern science, astrology, color therapy, genetics, physiotherapy, dental care. So it was like a very comprehensive care, of course. And to add a little bit on to this, as already mentioned, that Saumanasya Garbha Karanam. And as a practitioner, Manas Yoga specialist, I always feel that mental health is equally important in the antenatal care and also the preconception care. And I've been very happy to be a part of many such helping many couples in getting a healthy progeny. And why we should approach the mental health professionals in pregnancy or antenatal care. There are 4 protocols that are there. The first protocol, when they're absolutely mentally healthy, but still they need to approach to a mental health professionals to see that, because there are a lot of anxiety, and there'll be a lot of doubts, confusions. So it's always important that even you are mentally healthy, you need to approach to a mental health professionals. That is one category. The second category is those set of people who have some psychological problems and they end up in pregnancy. They always are challenging because they always think that they should stop all medications, they should stop all antipsychotics or antidepressants. So this is very, very important that they approach mental health professionals. The third set of categories are who are early diagnosed with mental health problems and then they become pregnant. And the fourth categories are when they develop the mental health issues for the first time during pregnancy. So these are the 4 categories of the women who could end up or coming to a mental health professionals, and all of them are very, very important. And that's why sometimes rather than having any medication, like rather than having a spinal anesthesia, the vocal anesthesia matters a lot in such conditions, and that is why there are a lot of importance for the mental health professionals too in the area of the antenatal care. It has been a great journey for all of us to host you all, and I'm sure the entire team of Janani has made their best efforts. And if at all we were had some lacunas, we are very sorry for that, and we'll see that. Please give your valuable feedbacks and see that we ensure that in the coming days we'll see that we do not leave any stone unturned in making your stay comfortable in the KLE platform. As we know, we are also launching the upcoming national seminar on the Nadi Pariksha and the Prakriti Pariksha on 4th of November in the same auditorium, but not in this auditorium. We are going for a bigger auditorium, expecting more number of delegates for this particular seminar. I would like to, on behalf of the institution and the entire team of Department of Kriya Sharira, I would like to welcome you all for this national seminar, Kriya Arohana, which will be hosted on 4th of November. I request to kindly pass out this message to all your friends to have this maximum delegation. We'll be sharing all the details very shortly. And I'm very happy that yesterday we had great luminaries. We had Vaidya Dev Pujari, Dr. B.S. Prasad, Dr. Sujata Gadam, Honorable Vice Chancellor, Registrar, who has been a great source of inspiration and motivation for all of us in areas of teaching, training, and research. And today we are very happy and very inspired by 2 of the very honorable chief guest and guest of honor. One in the extreme practices for more than 34 years, and other a very dynamic leader, teacher, and an administration. I think it's a perfect combination that we could have ever expected to be a part of this valedictory program. We would like to, on behalf of the KLE Iron World, would like to thank Saubhagya Madam and Hemant Sir for accepting our invitation and gracing today's occasion. It has been a great, truly inspiration for all of us hearing you. And really, as Hemant sir was telling, it is not important that you start with a little bit of perseverance. Your persistence is very, very important. How you carry out what you learn here is very, very important. And we're very happy as an institution to support in all possible way of your academic learning, healthcare services, and the research, as KLE Ayurved always stands for tradition, technology, and innovation. Once again, I would like to thank all of you for coming to our call and responding to our invitation and being a part of this memorable event. I would like to once again thank the entire organizing team, the university officials, the board of management of KLE Society, and all the wonderful resource person and speakers, the chairperson of different scientific sessions, the delegates from different parts who have joined us, and without whose support this session or this event would have been possible. Once again, I would like to thank and we would like to welcome you and see you all again in the month of November. Thank you.
Thank you, sir. As we now move closer to the end of the valedictory, I call upon Dr. Gayatri Hubli for the vote of thanks.
Good afternoon, everyone. I am pleased to be standing before you on behalf of KLE Shri BMK Ayurveda College. My work is done half by Principal Sir. Principal Sir is already said thanks to all them. So I will be very brief here. So starting, a particular mention goes to our esteemed Chancellor, Dr. Prabhakar Kore Sir, Vice Chancellor, Dr. Nitin Gangane Sir, Registrar, Dr. M.S. Ganachari Sir, Chairman of the Janani 2023, Dr. Suhas Kumar Shetty Sir, Principal, Dr. Prashant Jadar Sir, Dean, KLE BMK Ayurveda College, Organizing Secretary, Dr. Girija Sanikok Madam, HOD, Department of Prasuti Tantra Sriro. So today's chief guest, Dr. Saubhagya K. Bhatt Madam, Consultant OBG, Patets Fertility and Research Center, Belgavi. Guest of honor for today, Dr. Hemant Toshikane Sir, Dean, Faculty of Ayurveda, Parul Institute of Ayurveda, Vadodara, Gujarat. A special thanks goes to all the committees, starting from the organizing committee, stage, reception, registration, catering, scientific, e-souvenir, accommodation, IT and technical staff, support system, and all the volunteers and the delegates who have come from various places. A special thanks to all the resource persons, namely Sindhu Madam, Sapna Madam, Kirti Madam, Anita Madam, Swarda Madam, without which the conference would not be in success. They have all delivered the talks, which were very useful. All the chairpersons for the scientific oral presentations and the plenary sessions. A special thanks goes to all the sponsors, that is Chaitanya Pharma, Paleps Pharma, Jandu Pharma, and KLE Pharma. Again, a special thanks to all those who have helped us directly or indirectly and made the event a great success. Thank you one and all.
Thank you, ma'am. As we now officially conclude Janani 2023, I request everyone to raise for the national anthem. I call upon Ms. Neha and Ms. Sakshi for the same.
पंजाब सिंध गुजरात विंध्य हिमाचल यमुना गंगा उज्जल जगत्करंगा नव शुभ नामे जागे तव शुभ आशीष मागे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता Jaya He, Jaya He, Jaya He, Jaya 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 He.
I thank everyone, the guests as well as all the the delegates who have been here. A few announcements. So for the delegates who have not done any paper or poster presentations and just joined as delegates, only their certificates will be given. So those who have done poster or paper presentations, so those will only be your